everyone, and welcome back to lecture. Up through today we have been talking about drugs in a more general sense, and we've been focusing on some of the biological functions that are associated with drug use, whether they're illicit or licit drugs. Today we're going to begin our exploration of the individual drugs that we've been talking about in a more general sense, and we're going to begin that exploration by focusing on CNS depressants. So to begin with, we have to address the biggest item of the lecture here. CNS depressants are drugs that are going to affect what? They're going to affect the central nervous system. That's what CNS stands for. But what exactly is your central nervous system? It is the complex system of nerve and tissues that control the activities of the body. In vertebrates, this means that it is comprised of your brain and your spinal cord. So what does it mean when your CNS system is depressed? This means that everything is going to slow down. Your reaction times are going to lessen. The individual is going to be severely relaxed. Breathing is going to become easier, and the person potentially might get sleepy. The predominant reasons for taking these pills are really to treat insomnia and anxiety. We don't want to become overwhelmed by anxiety or become a chronic insomniac, so the doctor prescribes us something and it helps us to relax and it helps us to go to sleep. Unfortunately, those feelings are very nice feelings. Everybody likes to be relaxed and have an easier time falling asleep, especially when you're stressed out. So you can imagine the appeal of these drugs as a recreational drug rather than being used for the utility that they were originally intended for. So I want to spend a few minutes now focusing on some of the more popular CNS depressants that are more commonly prescribed by physicians. The first one we have here is Xanax, and this is a drug that helps you with anxiety. So your brain is producing chemicals that produce anxiety in the body. Xanax goes in there and balances out these chemicals and lowers the anxiety that you feel. With the different doses, you see that there are 4 varieties available here. The stronger the dose, the more of an effect that is felt by the person taking the drug. Xanax is actually the 12th most frequently prescribed medication in the United States. It works really quickly in relaxing the patient, but it also happens to have a pretty fast half-life. So once the pills wear off, then you want to take another pretty quickly in order to feel the effects of the drug that you were feeling before it wore off. Next up, we have Ativan. Ativan is an anxiety medication, but one of its main side effects, is that it limits the retention of new memories. So this is really meant to be a short-term medication and is only supposed to be prescribed for about 2 to 4 weeks at a time. It takes a few doses before the symptoms of anxiety really start to go away, but it is frequently used as a sleep aid in hospitals in a single dose. Our next drug of choice is Klonopin, which is used to treat seizures, panic disorders, and certain movement disorders. This drug actually has a pretty high suicide rate for its users, so it's not often prescribed in comparison to the others that we're seeing today. But the half-life of this drug is a bit longer than other ones that we're talking about here, and about 1/3 of all Klonopin users actually become dependent on the drug in about 3 weeks of use. So this pill actually is one of the ones that has a stronger frequency, or a higher frequency rather, for recreational use in comparison to the others because of its dependence issues. Other countries do not have the same regulations that the United States has set up for the use of Klonopin, so it's a lot easier to get in some of these other countries than it is in comparison to the United States. Our next one is Valium, and Valium is really the big one. So Valium is a medication that is part of the benzodiazepine group that alters the function of the mind. And it is more commonly used to treat a range of conditions that include anxiety, alcohol withdrawal syndrome, benzodiazepine withdrawal syndrome, and muscle spasms, seizures, if the patient has trouble sleeping, and sometimes even for restless leg syndrome. It may also be used to cause memory loss during certain medical procedures, which can be purposeful at times, and it's the type of drug that can be taken a variety of different ways, predominantly orally, but it can also be inserted into the rectum if the patient has trouble swallowing. It can be injected in the muscle, so intramuscularly, or it can be injected into a vein intravenously. So when given into a vein, Valium actually, the effects begin pretty quickly in about 1 to 5 minutes after injection, and they can last up to an hour. But by mouth, the effects have to take a little bit longer to kick in, so we're looking at about maybe 40 minutes or so. Interestingly, Valium is so frequently prescribed that it has made its way onto the World Health Organization's list of essential medicines, and that means that this is one of the most important medications needed in a basic health system. And then finally, our last one on the most commonly prescribed list, Restoril. Restoril is primarily used as a drug to treat insomnia, and in sleep laboratory studies, Restoril significantly decreased the number of nightly awakenings, but it has the drawback of distorting normal sleep patterns. It is officially indicated as a drug to treat severe insomnia and other severe or disabling sleep disorders. The prescribing guidelines in the United Kingdom actually limit the prescribing of hypnotics to 2 or 4 weeks due to concerns regarding tolerance and dependence levels. Something really interesting about Restoril, if you take it and you happen to be in the United States Air Force, the Air Force uses Restoril as one of the hypnotics that are approved for their pilots to take, but it happens to be on a no-go pill list. And really what this means is even though the pill is helping you get ready and helps you get rested up for specific missions, they don't want you taking this so close to flying or going out on a specific mission. So after you take the pill, you have a 12-hour restriction that is imposed before you're able to operate an aircraft. So that really tells you, based on the, limitations that the Air Force is putting on this medicine, how powerful this medication can be if they don't want you flying an airplane within a certain amount of time after taking this medication. So let's look at things in a more general sense. Like most medications, CNS depressants have many benefits, but there's also a variety of problematic side effects that can occur with its use. But we have to ask ourselves, why are they problematic? And mainly, it doesn't take very long to become dependent on these pills. For some individuals, it takes as little as 3 weeks to a month before dependence sets in, which is a pretty relatively short period of time. Additionally, these drugs are not difficult to get at all, as doctors prescribe them very often for a variety of different medical issues. For example, Xanax, one of the drugs I mentioned before, since Xanax has become available, doctors have written more than 47 million prescriptions for that drug. So that's a lot of pills being floated around. And as you know, we don't always use everything that we're prescribed, and that makes it very easy for these pills to be sold for quick money. And finally, when you have something that creates dependence very easily, you also have to worry about the idea of severe withdrawal that can come from these drugs. CNS depressant withdrawal can result in death or seizures or mental impairment if you're not careful. So withdrawal needs to be monitored if the individual is really dependent on the prescription medication. These are really strong drugs that we're talking about, so monitoring is important. If we're worried about dependence issues, how do you think that doctors actively monitor these meds? The answer is often the issuance of short prescriptions. So if the drug has a high frequency of dependence, then don't give someone the opportunity to develop that dependence. Only give the individual enough of the medication for, let's say, maybe 2 weeks or so, and then you have to force that person to come back to your office so you can discuss the effects that the drug has had on your patient. However, not all doctors do that, or if the doctor does require that, the patient might end up doctor shopping to avoid questions if their original physician denied them refills. So they just might go around and around until they get their next prescription filled. So then we're running into the issue that we were discussing before. High amounts of prescriptions are being written. There's some level of self-medication taking place and some level of recreational drug use occurring. Then you have people who aren't taking the drugs as prescribed, or even worse, they're mixing things together. So what you then have to worry about is the idea of accidental overdoses if the patient is not being careful with the medication they're being prescribed. Most people who overdose on CNS depressants end up taking too many pills, or they combine alcohol with the medication they're using and their bodies just start to shut down. But when we talk about accidental overdoses with CNS depressants, we're not talking about a violent overdose or anything here. What you end up seeing is that people just simply go to sleep. Remember that these drugs are supposed to depress your brain function. So if you're taking more of the drug than is recommended to the point of overdose, your brain stops functioning and you simply stop breathing. As I just mentioned, mixing these medications together can cause a lot of problems for the user, especially when they perceive the original drug to no longer be working for them. Your book gives the example of Heath Ledger as an individual who mixed drugs and eventually overdosed as a result. So Heath Ledger was an individual who was taking so many pills that really it was only a matter of time before something happened. Over the years, he had been taking a number of things, and then it caught up to him, and when he did pass away, they ended up finding oxycodone in his system, which is a pain medicine, hydrocodone, which is also a pain med. They found Valium, which is an anti-anxiety drug, Restoril that we mentioned before, and that is an anti-insomnia drug, Xanax, which is also an anti-anxiety drug, and doxylamine, which is actually the main ingredient in things like NyQuil or ZQuil, which is in the group of antihistamines that we'll talk about later. So if you keep compounding a bunch of depressant type drugs together, you are essentially creating additive interactions between them, resulting in further depressant effects than any one of these drugs would be capable of creating on its own. So you can see that if you keep adding them together, how dangerous this mixture can end up being. Our country has always had this love-hate relationship with alcohol, and towards the end of the 1800s, really it's occurring throughout most of the 1800s, particularly near the end of the 1800s, we're seeing this strong movement towards prohibition, with the temperance movement really leading the charge towards the idea of prohibition. So because people don't want alcohol to become more popular than it already is, there's sort of this push for a substitute type of treatment. So enter bromides. Bromide compounds, especially potassium bromide, were frequently used as sedatives in the 19th and early 20th century. Their use in over-the-counter sedatives and headache remedies such as bromo seltzer in the United States really is extending all the way into 1975, when bromides were finally withdrawn as ingredients due to their high chronic toxicity. Bromo seltzer is actually used as an antacid medication and is set to be the precursor for things like Alka-Seltzer and Tums. In this picture here, you actually see the label from a bromide bottle, which was sold in the 1800s from Physicians Pharmaceutical Company. And in this slide, you see a couple additional bromide bottles that were used to cure things like tainted blood and colds. In addition, bromides were predominantly used in mental asylums, and they were used to treat seizures of the patients that were housed there. We also saw kind of a strange application, but remember the time period that we're talking about here, that bromides were used for women who were considered to be too sexual. And the prevailing thought was that if you had prolonged use of bromides, that this would cure their sexuality and they would be less promiscuous in the eyes of people who were trying to treat them, right? So the biggest issue with bromides sort of resulted or resided in their high toxicity levels, which would then result in neurological and gastrointestinal disorders, or could cause high levels of irritability and hallucinations and deliria or lethargy in the patients that took bromides. These problems were the result of the long half-life that bromides had. And it took about 12 days before the medicine actually stopped being potent within the person's system. And because it was in your system for so long, this resulted in an accumulation of the bromide in your tissue. So as a result, you were just constantly keeping the patient in a high level of toxicity there. So eventually, bromides are going to be phased out once we have this new thing on the market called barbiturates, and that's really going to pop up in the early part of the 20th century. So in the early 1900s, barbiturates were developed sort of as an idea or as an alternative to the very highly toxic bromides that we just talked about. And barbiturates were actually developed sort of as a fluke, really, by a German chemist named Adolf von Baeyer in 1864, and he was experimenting with a chemical compound that he had derived originally from apples. And he found this, like I said, sort of a fluke, but he named the compound that he discovered barbituric acid, and he named it that name because he figured he discovered the drug on St. Barbara's Day. So basically what he did, he tested the drug on himself and some friends of his and some locals who had been frequently attending a nearby tavern, and he discovered that he had created a psychoactive drug that he had then named barbiturate. When given to humans, it actually induced sleep and was one of the first hypnotic types of drugs that were developed. And hypnotic is a term that is used to generically categorize any sort of chemicals that induce sleep. So Mr. Bayer became famous, and his established chemical research actually won him the Nobel Peace Prize in chemistry in 1905. And if his name sounds familiar, you may recognize the name Bayer as the pharmaceutical company that still bears his name and still exists today. As with many of these inventions, the desire to market the drug really overshadowed the appropriateness of the compound, a problem that is still prevalent today as drug companies try and rush and create these new drugs. So in the case of barbiturates, the original barbiturate that Bayer discovered induced sleep, but it metabolized very slowly, meaning that a person was sleepy and under its influence for long after the desired 8 hours of sleep that you were trying to use the drug for. And in 1912, under sort of trying to take Bayer's barbiturate further, other chemists developed phenobarbital, which is still used today. So here's a tip. Anytime you see a drug that has the word barbital in it, that is a barbiturate. So phenobarbital is still used as a treatment today for things like epilepsy, but it's used more commonly for that treatment in more developing countries. And it's more rarely prescribed in the US anymore to treat epilepsy, but it is one of the oldest forms of anti-seizure medications that are available. In comparison, a very similarly named drug, pentobarbital, is still used for the execution of prison inmates in some states and for the euthanasia of animals. So, compared to the bromides of the 1800s, barbiturates were considered to be far more safer. The half-life is shorter and they're less toxic in comparison. People were then still able to function while they're taking these medications. But as time went on, we realized that there were still bigger issues that we hadn't solved. Tolerance and dependence became the two biggest concerns, as people were relying on barbiturates for everything and took them all the time. So as barbiturates were a primarily injectable drug, it then raises concerns in regards to overdosing, as the margin of safety is much narrower when you have injectable drugs in comparison to drugs that you take orally. Even though barbiturates were better than bromides for a variety of reasons we just mentioned, barbiturates were still considered to be too addictive and too dangerous. So, chemists went back to the drawing board once more and continued to tinker with the chemical compounds that they had already established. By the 1950s, a research chemist named Leo Sternbach began tinkering with an unknown class of compounds, which he labeled as BZDs, or benzodiazepines. For several years after that, he tested some 40 BZDs, but all of them had proved ineffective for his purposes. But by 1956, after he added methylamine, a colorless gas that he had derived from ammonia, to one of the compounds that he was tinkering with, he actually produced a white powder that he then tested on mice and they started becoming very sleepy and very calm as a result of this administration of the drug. So the FDA then approved Librium, the very first ever benzodiazepam, in 1960, and later approved Valium in 1963. So the way that benzodiazepams work is that they latch onto a receptor in your brain, which then activates a neighboring neurotransmitter known as GABA. GABA then releases, let me say it this way. GABA release makes people calm and makes people sleepy. And the drugs that can trigger GABA tend to trigger it in minutes, and it allows the user to feel calm almost immediately. So initially, benzodiazepams were hailed as like the silver bullet. We figured it out. It's a medical miracle. And very quickly became one of the most widely prescribed class of drugs in the world. Even though that the drug's addictive properties have now become clear over the years, these types of drugs, benzodiazepams, are still widely available and often are prescribed for longer than the recommended 2 to 4 weeks. So we're running into the tolerance issues again. So tolerance to the drugs is thought to occur because the benzodiazepams weaken the response of the receptors in your brain. So this means that a benzodiazepam user needs to keep ramping up their dosage in order to keep triggering the same calming effect that occurs via the release of GABA. These drugs are also very non-specific in nature, and they're able to sort of interact with different subunits of the GABA releasers. And this basically controls different actions that people exhibit. So the drugs then decrease anxiety or restlessness, and they also have an effect on your motor control and your cognition. So even if a person goes on the drugs to originally alleviate social anxiety, inevitably what happens is that they alter the way that they think or how they sleep or even move, things like that. So in turn, this explains why a person who's coming off benzodiazepams may experience brand new symptoms that they never experienced before, such as panic attacks or seizures. I want to take one step back real quick as we transition away from barbiturates into benzodiazepams, and I would like to talk about one of the most famous cases of barbiturate misuse in the case of Marilyn Monroe and her subsequent overdose through the use of barbiturate medications. Marilyn Monroe had a history of depression and really went through several failed marriages, and she miscarried a few times and really just was struggling a lot with depression over the years. She's in and out of different psychiatric clinics where she keeps getting prescribed a variety of different barbiturates, and she keeps taking all of them. So in 1962, she actually receives a prescription for 25 Nembutal tablets, and she ends up swallowing them all one night. A fellow actor, Peter Lawford, calls her the night of her overdose to invite her over for dinner. And when he talked to her, he said that her words were really slurred, and he really couldn't understand her, and it was something, their interaction was something that worried him and concerned him. So she says goodnight to him, and the line disconnects, but her telephone line is busy for the rest of the night. So Peter Lawford calls her attorney and is told that Marilyn Monroe is fine, not to worry, but he's very distrustful of that information. So he then calls his own attorney and tells him to go over to her house and check on Monroe. She's actually passed out in bed with the phone in her hand, but her bedroom door is locked, and they have to break into the room through the patio balcony. And they find her about 4 o'clock in the morning, and it's very clear that she's been dead at this point for several hours. And they do rule her death an overdose. And the autopsy's report, the coroner's report, comes back and says that she had about 40 or so pills in her system at the time of her death. So it's very clear that she has ingested more than just the Nembutal that was prescribed to her, and most likely she had been stockpiling pills before her overdose and then was able to consume 40 at one time. Marilyn Monroe then becomes the figurehead for realizing how dangerous barbiturates can be. And as benzodiazepines have already been developed, doctors are very quickly taking advantage of their availability, and they start prescribing those instead of the still unsafe barbiturates. So they're going to be continuously phased out, and the use of benzodiazepines are going to increase. And benzodiazepines become so widely prescribed that it seems like everyone is taking them all the time. Considered almost harmless in comparison to the earlier two versions of the drug that we talked about, and they're not at the time considered very habit forming, this then becomes the new solution to the previous two unsafe drugs and helps to solve our anxiety. And women are much more likely at this time to receive prescription for benzos than men are, to the point where Valium became the best-selling medication of the 1970s and actually earned the nickname of Mother's Little Helper. Valium originally only came in the small yellow pill form that's referenced in the Rolling Stone song that you see on the screen here, but at this point Valium is more than 50 years old. It has reached more than $1 billion in sales since its release and was the leading prescription from 1969 to 1982. And as women were the primary individuals who took Valium, pharmaceutical companies specifically targeted this demographic in their advertisements. I have two of those advertisements for you. In the next two slides, I'm going to show you two pharmaceutical ads from the 1970s. And you see here that the messages really focused on the idea of the busy, stressed out housewife or the busy, lonely, single working woman. So in the first one here, we actually meet Jan, who is described as 35, single, and psychoneurotic. And you see here there's a series of different photographs, and these photographs span 15 years of Jan's so-called failed relationships, and she now needs Valium to help her through her days because she's just so lonely because she doesn't have a husband. And I know that this ad might be a little bit hard to read, the writing's a little bit small, so I just want to read a little bit here to show you, I guess, the stories of Jan's life here and describe the last picture in the series, because that's sort of the rationale for why she needs Valium. So it says here that the pursuer on her cruise ship took the last snapshot of Jan. I guess this one here at the very corner in 1970. You probably see many such Jans in your practice, so this is something that is geared towards a physician. The unmarried with low self-esteem, right? Because she doesn't have a husband, so of course she has low self-esteem. Jan never found a man to measure up to her father. Now she realizes that she's in a losing pattern and that she may never marry. Valium can be a useful adjunct in the therapy of the tense, over-anxious patient who has a neurotic sense of failure, guilt, or loss. Over the years, Valium has proven its value in the release of psychoneurotic states, anxiety, apprehension, agitation, being alone, or with depressive symptoms. So hopefully you wouldn't see such a, extremely and blatant sexist advertisement that would occur here in 2017, but you never know. However, in 1970, the social dynamic was pretty different, and at the time that was considered rather acceptable. So with the next one, it gets even better. In this advertisement, we see a subsequent pharmaceutical ad for a drug called CRIJ, and here this is a different variety of advertisement that has a very similar message. But here we have the woman who's depicted as the quintessential overworked and stressed out housewife who is struggling very much to keep up with everything. And she can't stop being a housewife because at the time it was expected that she would handle everything herself, as her husband's only job was to work. And he didn't have to worry about anything when he came home because she was taking care of it all herself. So having to deal with all of the different jobs that she has, being, quote, just a housewife, right, it's very stressful for her. So instead of providing her any sort of help at home, you just have to simply dope her up and then she won't complain about it all and it'll be easier for her to work. So this ad is reading, you know this woman, she's anxious, tense, irritable. She's felt this way for months. Beset by the seemingly insurmountable problems of raising a young family and confined to the home for most of the time, her symptoms reflect a sense of inadequacy and isolation. Your reassurance and guidance may have helped some, but not enough. CRIJ cannot change her environment, of course, but it can help relieve anxiety, tension, agitation, irritability, thus strengthening her ability to cope with day-to-day problems. Eventually, as she regains confidence and composure, your counsel may be all the support she needs. Its availability is in 10, 15, and 30 milligram capsules. So like I said with the previous advertisement, this obviously sets a very sexist marketing campaign tone, but again, very common for the 1970s, and it had a very specific message geared to a very specific clientele. With this advertisement, obviously they're targeting the husbands of the overworked, anxious housewife who isn't able to play her role to the best of her ability. So, get your wife CRIJ and life will be a lot better for you. As we previously discussed, there was sort of this massive increase in the amount of prescriptions that were being written at the time for benzodiazepines. And there is still the potential for abuse with these drugs, but not to the same extent that was present for barbiturates. However, they are still scheduled drugs and are classified as Schedule 4. As a reminder, Schedule 4 drugs require you to have a prescription for their use, but they are different from Schedule 3 in terms of their dependence threshold. The potential for abuse is less severe than with Schedule 3, but these are drugs that still have to be overseen by doctors, which is why they are not classified as Schedule 5 drugs, which are your typical over-the-counter drugs. So let's talk a little bit about the effects of benzodiazepines. There are basically two types of effects that benzos can have. First, there are the sedative type drugs. These are the ones that are going to keep you calm, they relax you, they help you breathe better, and overall you just generally feel less anxious. Hypnotics, on the other hand, are the stronger of the two types. These are the ones that are set to knock you out. These are your sleeping pills, and those are the ones that can sometimes cause memory loss with extended use of the medication. Even though the basics of these two types are very similar in nature, it really comes down to the strength of the drug that will have an impact on what effect it's going to have. So the thing to remember here with these two types of drugs are the doses. So the sedatives are generally a lower dose medication, and these are the ones that you're taking with the hope that you'll still be able to function while under the influence of the medication. On the other hand, the hypnotics, these are the ones that are much stronger in terms of dosage. You're not trying to function when you take one of these. Your main goal is just to sleep and to be unconscious. Anesthetic benzos, on the other hand, are used primarily as a local anesthetic or as a general anesthetic, but these are not the drugs that have any pain relieving qualities. So therefore, most hospitals only use them for very short-term procedures, but the dose is high enough to put you out, and you won't wake up until the medication is reversed and the benzodiazepine is removed from your system. So currently there's about 15 different types of active benzos that are available for prescription in the United States, and all of them have very similar side effects, but the most common one is drowsiness, because remember, these are depressants after all, and that's the primary function that we have been discussing in terms of these medications. So we talked about the stronger doses having a more drowsy result. The hypnotics put us to sleep, but what's most interesting is that their half-life is much shorter than the half-life of the sedatives. So higher dose, shorter half-life. Lower dose, longer half-life. It's the exact opposite of what you would expect to occur. And finally, the last item I want to discuss with you today is the idea of abuse. So in order to determine whether or not an individual is abusing the drug, you must look at the behaviors of the individual and how he or she is using the drug. Remember that these drugs allow us to try and function without making huge physical alterations like narcotics do, for instance. As an anti-anxiety medication, people use drugs to relieve the continual stress that they have in their lives. However, when we are discussing abuse, it's no longer about the original effect of the drug, but the tolerance in the individual is strong enough that you're just trying to feel normal, so you have to take more of the medication. The individual is so used to having the benzos in their system that they are then stressed out without the benzodiazepine in their system, and they need to continue to take it in order to feel normal, often at higher amounts than they originally were prescribed. There is also this paradoxical experience of feeling euphoria and stimulation that comes from depressants. And as we've been talking about this entire lecture, benzodiazepines are depressant type drugs. So if it is a depressant, then how can I feel stimulated? Certain drugs, interestingly enough, actually are able to produce a stimulant-like feeling if the user's tolerance is high enough. Think about it this way. Have you ever seen someone who is a very talkative and very excitable drinker? They just talk, and then it seems like they hit a wall and then just start to slowly get depressed, right? So the same thing occurs with alcohol sometimes. The first few drinks produce this stimulating effect until you hit that threshold dose, and then the depressant factor starts to kick in. Next, we will see that some people use depressants to counteract the unpleasant effects of other drugs that they might be abusing. I take stimulants and I counteract them with the depressants to bring myself down once again. Or I can combine depressants with alcohol or potentially heroin to potentiate the effects. I take two depressants together to strengthen the depressive effects of the drugs, as neither one of these drugs would be able to do enough for me on their own. And lastly, just a brief note about detoxing and withdrawing from these drugs. The tolerance level for these drugs is really strong, and often you cannot withdraw from them without adequate medical supervision. Withdrawal from CNS depressants can be just as fatal if left unsupervised in comparison to something like heroin, right? So if you go cold, you cannot go cold turkey. They have to wean you off, and they have to give you low dose sedatives that have a longer half-life to get your body used to the idea that you're not receiving high doses of CNS depressants anymore. So it can be just as serious as the heroin withdrawal process, and you have to receive this mediating drug to help wean yourself off. But we'll discuss heroin withdrawal a little bit later in the semester, but think about it in that way as we move forward. So that's all I have for you on Chapter 6 and the CNS depressant drug types. So as you're going through this, just sort of keep an eye on the evolution of these drug types and how they have been developed as a necessity over the years, where first we have bromides that are not working the way we want them to, and they have high levels of toxicity. So barbiturates come into play as a way to counteract or sort of alleviate that toxicity, and those are still not working. So then we turn to our benzodiazepine, and for the most part that seems to be the drug of choice, even though we still have to combat and counteract the high levels of dependence and sort of chronic use that we see in some individuals. So it's our best shot for now. So that's about it, and if you guys have any questions, let me know, and if not, I will see you in the next class session. Thanks a lot, guys. See you later. Bye.